So, anybody in here who's ever been in healthcare, nurse, physician, all of us at some point got into this field to be able to help people get at the time when they're most vulnerable, which is when they're not healthy. And so that drives all of us, and our family stands behind it. And what I have in front of you is Article 25, a 1948 Universal Declaration of Human Rights. Couldn't say it better. Everyone has the right to a standard of living adequate for the health and well-being of himself or herself and their family. And this right should be universal with some responsibilities. So that drives us, but what's happening throughout the world? I grew up in India, and I came when I was about 9 years old. I was born in a city called Calcutta. Anybody who's been to Calcutta will know how difficult it is to have healthcare in Calcutta. And I grew up in a city called Bangalore. And I tell my kids and my wife that I remember, even as a young kid, that little boys and little girls would come to my door and beg for food. And that vision never left me, to understand how lucky we are in this nation and around the world when you have access to healthcare and adequate resources. But when you look, over 1 billion of us have lack of access to healthcare, over 1 billion. And you see on this slide, 36 million people die of preventable disease, cardiovascular disease, cancer, chronic lung disease, things that are preventable. And because of lack of access, lack of knowledge, lack of information. 7.5 million children under the age of 5 die from malnutrition and mostly preventable diseases, and over 6 million people die of infectious disease alone. Now, if you look at the headlines, you can hear about all the tragedies that happen, but just the last subpoint, 6.7 million people, far, far more people die of infectious disease alone than the man-made tragedies. And the point here is that, we're not doing our job. We're really not doing our job. People are not getting access to healthcare. So why? Physically, what's happening is that you just can't get there. You can't see the doctor. You can't go to the hospital. A brilliant man from India, he talked about the last mile. So you can get healthcare to a certain point, but it's that last mile that prevents us from giving the medication, that prevents us from giving that last bit of advice or the prevention that we need. And you don't have to go very far. All you have to go is to go to 10 Mile and then make your way to 8 Mile. Then you go to 7 Mile. The vast divide that's in our city, in our nation, is that last mile. And we have to fight it. We have to understand it. Grab it and say, what can we do to change it?